Hello, everyone. My name is William Lawler. I'm a PhD student in chemical engineering at RPI. And about 5 years ago, I read an article about how whales, despite having 1,000 times more cells than we do, almost never get cancer. The reason for this is they actually have better mechanisms to repair their genes than we or most other animals have. Now, that little fact is what originally got me interested in genome editing. And after looking into it, I found the technology to have such potential that I felt like I had to pursue it. Thankfully, I'm not the only one who's seen this potential. The Commissioner of the Food and Drug Administration, the body responsible for regulating all medicine and therapeutics in this country, has also come out in support of gene editing products. But what sort of impact do your genes actually have on your health? So almost every human disease can be tied back to some genetic factor, either direct causation or a set of genes giving you a predisposition towards a specific disease. Many diseases can also be cured by treating those underlying genes and fixing them. But why should we do genome editing instead of relying on more traditional medicine? Genome editing allows you to address the root cause of the problem, the underlying cellular dysfunction, and fix something in a single step rather than having to take a continuous course of medication. So what kind of conditions could you address with genome editing? There are actually thousands of conditions that you can fix with genome editing. Some of them include things like Alzheimer's and type 1 diabetes. Even some aspects that we associate with normal processes of aging are actually DNA damage related. But the ultimate goal we have for this technology in the long run is to be able for someone to go to their doctor, and after a brief genetic screen, the doctor can come back and say, oh, you have some genes that predispose you towards Alzheimer's or some form of cancer. And the doctor can then say, oh, we can give you a shot that has these gene editing components in it, fix that underlying gene, and 10 to 15 years later, you don't have to deal with Alzheimer's. You don't have that cancer that you were previously predisposed to. But how do you actually do genome editing? So you can think of the genome as a chain of information, and with each link in the chain representing a specific gene. Now, what currently is used in the genome editing field is something called CRISPR. Some of you might have heard of it. So CRISPR is focused mainly on knocking out genes, whereas the technology we've developed is focused on inserting new copies of genes. So in this way, we can insert a new copy of a damaged gene and restore the normal functioning, or insert a new gene and allow the cell to have a different functionality or improved functionality. So this is sort of what we're talking about. This is a visualization of the system we've designed. You can see the DNA double helix there, the orange portion, and wrapped around it is part of our editing system that's actually targeting that specific gene for modification. So in terms of applications, one of our first things we want to target is organ transplants. So if we modify organ transplants prior to their transplantation, we can actually lower the chance of organ rejection and limit the amount of immunosuppression that's needed following transplantation, which greatly improves the patient outcomes. However, the main goal with the technology is trying to reach that in vivo or in the body market, trying to be able to treat things in the body rather than having to do things outside the body like a lot of current gene editing therapies have to do. So the current market for genome editing is about $8 billion. Now, when you compare that to the Alzheimer's drug treatment market, which is $2.2 billion, given the number of conditions that genome editing can treat, this number is remarkably low. This is because current technologies are very limited in what they can do in terms of applications. They have to rely on very specific circumstances to work. And that's the problem we're trying to fix with our technology. We're trying to make genome editing more useful in more cases to treat more diseases and help more people. And with that, we're hoping to expand the genome editing market way beyond where it currently is to be able to really help a lot more people. In terms of IP, right now we have a patent pending on the integration system we've developed and a provisional patent on a delivery mechanism we've developed to help us do that in vivo genome editing, reach different cells in the body. We've also received $25,000 from the NIH to the company to do our research and do our work. And we've also successfully demonstrated that delivery system in mice, where we were able to deliver components through the blood-brain barrier to regions of the brain. This will be very useful in treating things like Alzheimer's in the future. We've also demonstrated successful editing in human cell lines, which is an important step. And we've also appeared on local CBS6 News, reporting our research before. In terms of timeline, in the next month or so, we plan to demonstrate the accuracy of our editing in human cell lines. Then in the next couple of months, we plan to work on editing pancreatic islet cells. That's in trying to treat things like type 1 diabetes. That work is being done in conjunction with Mount Sinai Hospital. And in the next several months, we plan to work with the Neural Stem Cell Institute here in Albany to try and edit difficult to transfect neural cell lines. That's again trying to treat things like Parkinson's and Alzheimer's. And hopefully next year, we plan to begin our preclinical testing in mice models as we move towards clinical trials. So this is the current talented team that myself and Professor Mateos Kofis and the leadership team. On our advisory board, we have Professor Brett Orzakowski at UAlbany and Professor Eric Ledette at RPI. Thank you both. And also we have a number of students working with us to help develop the business model, one of which is here today. Thank you, Quinn. Yeah. In terms of asks, we are looking for anyone who can help us commercialize this technology, anyone with previous biotechnology commercialization experience who'd be willing to work with us and help develop this technology and move it towards market. We're also looking for anyone with regulatory expertise to help us plan our clinical trials and execute those. Also, any potential research partnerships. We are always looking to explore new applications of the technology and develop new avenues. With that, I'd like to thank everyone for coming out. Any questions?
So if someone has a question, we have a microphone that we're passing around, so just put your hand up and Michael will come over and give you the microphone.
Yeah, you mentioned delivery to the brain. What's your delivery mechanism?
So you asked about delivery mechanisms to the brain. Yes, so what we used is an exosome-based system where we used a novel method of packaging things in there, which is sort of protecting our information as we kind of pass it through the cell. Does that answer your question?
Right. What kind of efficacy do you see off of that?
We saw very strong delivery.
Okay.
We were able to get a large percentage of the brain correctly transducted.
Thank you for the wonderful presentation. Great to see something as visionary as this at this event. Just curious, where do you think the right place to plug into the value chain is? You know, do you think of yourselves as a tool that partners with other researchers in developing a therapy? Do you think of yourselves as a library of custom tools per therapy? I'm just trying to think about how do you actually scale what you're doing into the value chain?
So in terms of entering the value chain, we originally planned on marketing this as more of a research tool. As we sort of go through clinical trials, develop more applications, really it depends on how fast we get through clinical trials, where things go. Obviously, we're trying for ex vivo after that initial period, and then in vivo applications further along is the plan.
So what do you think, both from a technical and from business standpoint, are going to be your biggest challenges getting this to market? I mean, this is the potential here is huge. Obviously, this is not a trivial thing to bring to the finish line. What do you see as being the biggest challenges?
One of the biggest challenges is just making sure that it's safe and making sure that it does its job very well, that unimpeachable kind of accuracy. That's one of our biggest challenges, I think. In terms of, right now the field is very much dominated by CRISPR, and we're sort of positioned as an alternative to that, which is good in terms of we can kind of skirt the licensing issues with that, but anyway.